What is non-regenerative anemia in veterinary medicine? Have you ever wondered why your pet might feel tired or weak? One possible reason could be a condition known as non-regenerative anemia. This term refers to a situation where the bone marrow does not produce enough new red blood cells to replace the old ones that die off naturally. As a result, there is a decrease in the total number of red blood cells circulating in the body. This can lead to less oxygen being delivered to the tissues, which is vital for your pet's overall health. Unlike regenerative anemia, where the body responds by making new red blood cells, non-regenerative anemia indicates a failure in that production process. This condition can affect both cats and dogs and often develops slowly, giving pets some time to adjust. Early signs can be quite subtle. You might notice your pet is more lethargic than usual, has a reduced appetite, or struggles with exercise. Increased breathing rates after activity and pale gums are also common indicators. In severe cases, pets may become very weak or even unable to stand. The causes of non-regenerative anemia are varied and can be grouped into several categories. Nutritional deficiencies are one common cause. If your pet lacks essential nutrients like iron, copper, or vitamin B12, it can hinder red blood cell production. Iron deficiency is often seen, but it is usually due to blood loss rather than diet alone. Chronic diseases can also lead to this type of anemia. Conditions such as long-term infections, inflammatory diseases, or cancer can suppress the function of the bone marrow, affecting red blood cell production. Kidney disease is another factor to consider. Since the kidneys produce erythropoietin, a hormone that stimulates red blood cell production, any dysfunction in the kidneys can result in anemia. Additionally, primary bone marrow diseases can directly impair the marrow's ability to produce cells. These include disorders like aplastic anemia or cancer infiltrating the bone marrow. Diagnosing non-regenerative anemia involves a thorough clinical evaluation and laboratory testing. Blood counts and reticulocyte counts, which measure young red blood cells, are essential. In some cases, a bone marrow examination may be necessary to gather more information. Treatment for non-regenerative anemia focuses on identifying and addressing the underlying cause. This may involve supplementing any nutritional deficiencies, managing chronic diseases, or treating bone marrow disorders. Supportive care can also play a role in improving your pet's quality of life during recovery. From a veterinary clinical pathology standpoint, understanding the mechanisms behind non-regenerative anemia is vital for accurate diagnosis and effective treatment planning. It is important to distinguish this type of anemia from regenerative types by assessing the bone marrow's response and evaluating various factors that affect red blood cell production. This knowledge helps veterinarians manage anemia effectively and improve outcomes for pets facing this condition.